students. I am Miss Alexander, your social studies teacher. Welcome to lesson 11. Today we are continuing by looking at our main topic, health and well-being. But we will now move into a new subtopic by looking at sexually transmitted diseases. Before we continue with today's lesson, we will just do a quick recap of what we covered in lesson 10. In the previous lesson, we understood that to identify abusive situations mean that you're able to recognize the signs and symptoms of abuse, either on a child or recognize the behaviors that lead one to conclude that they are abused. So here are some questions. True or false? 1. The specific signs and symptoms depend on the type of abuse and it may vary. The specific signs and symptoms may depend on the type of abuse and it may vary. Is that statement true or is it false? This statement is true. Let's go on to the second question. The presence of warning signs always mean that a child is being abused. The presence of warning signs always mean that a child is being abused. Is this true or is it false? If you said false, you are correct. Let's move on to the third question. Reducing the practice of child abuse requires a personal commitment. Reducing the practice of child abuse requires a personal commitment. This statement is true. And let's look at the final question, question 4. It is okay for parents and caregivers to discipline the child when their anger is out of control. It is okay for parents and caregivers to discipline the child when their anger is out of control. Is this statement true or is it false? I know that you listened keenly at the previous lesson, so you will be able to answer this quite correctly. This statement is false. Good job. I'm very happy that you remembered some of the key points from our previous lesson. Now let's move straight into today's lesson. What are our objectives? Students should be able to 1. Define the term sexually transmitted diseases known as STDs. 2. Identify the major STDs. And 3. Examine some of the symptoms and signs associated with those STDs. So let's begin today's discussion by understanding what are sexually transmitted diseases. STDs are sexually transmitted diseases, and they're also known as sexually transmitted infections or STIs. Some people prefer to use the term STI because they believe it is more accurate. This means that they are more often, but not exclusively, spread by sexual intercourse. The organisms, such as bacteria, viruses, or parasites, that cause sexually transmitted diseases may pass from one person to another person in blood, semen, or vaginal and other bodily fluids. Therefore, it becomes possible for these infections to be transmitted non-sexually. For example, infections are transmitted from mother to infant during pregnancy or childbirth, or through blood transfusions or shared needles. So now let's move on to looking at some major STDs. Some major STDs include chlamydia, HIV, gonorrhea, genital herpes, genital warts, some forms of hepatitis, and syphilis. So now let's move into understanding the STDs and their associated symptoms. Let's move into the first STD, known as human immunodeficiency virus, or HIV for short. HIV is an infection with the human immunodeficiency virus. HIV interferes with the body's ability to fight off viruses, bacteria, and fungi that causes illness, and it can lead to AIDS, a chronic, life-threatening disease. When infected with HIV, there may be no symptoms at all. Some people develop a flu-like illness, usually 2 or 3 weeks after being infected. Still, the only way to know if one has contracted the virus is to be tested. Early HIV signs and symptoms usually disappear within a week to a month and are often mistaken for those of another viral infection. During this period, the individual is highly infectious. More persistent or severe symptoms of HIV infection may not appear for 10 years or more after the initial infection. Early stage HIV symptoms may include fever, headache, sore throat, swollen lymph glands, rash, and fatigue. As the virus continues to multiply and destroy the immune cells, the individual may develop mild infections or chronic signs and symptoms, such as swollen lymph nodes, often one of the first signs of the HIV infection, diarrhea, weight loss, fever, cough, and shortness of breath. Now, those that we just discussed were the early stage symptoms of the HIV infection. Now we will take a look at the late stage symptoms of the HIV infection. Those include persistent unexplained fatigue, soaking night sweats, shaking chills or fever higher than 100.4 degrees Fahrenheit or 38 degrees Celsius for several weeks, swelling of the lymph nodes for more than 3 months, chronic diarrhea, persistent headaches, and unusual or opportunistic infections. So now that we would have had an understanding of the HIV infection, we will now move on to understanding gonorrhea. Gonorrhea is a bacterial infection of your genital tract. The bacteria can also grow in the mouth, throat, eyes, and anus. The symptoms of gonorrhea. The first gonorrhea symptom generally appears within 10 days after exposure. However, some people may be infected for months before any signs or symptoms occur. Some of those signs and symptoms include thick, cloudy, or bloody discharge from the penis or vagina, pain or burning sensation during urination, heavy menstrual bleeding or bleeding between periods, painful or swollen testicles, painful bowel movements, anal itching, burning during urination, and yellow, white, or green discharge from the penis. It must be noted that most women do not have symptoms of gonorrhea. If they do, they're often mild and could be mistaken for something else. Those include burning or pain during urination, bleeding between periods, more vaginal discharge than is typical or than is usual, as well as pain in the abdomen or the belly. As we wrap up today's session, let us relook at a few key points that we would like to take away. 1. STDs are sexually transmitted diseases, also known as sexually transmitted infections, or STIs for short. 2. The organisms that cause the sexually transmitted diseases are bacteria, viruses, and parasites. 3. Organisms are passed from one person to the other in blood, semen, or vaginal and other bodily fluids. It therefore becomes possible for these infections to be transmitted non-sexually. 4. Some major STDs include HIV, gonorrhea, genital herpes, and genital warts. 5. HIV is an infection with the human immunodeficiency virus. HIV interferes with the body's ability to fight off viruses, bacteria, and fungi that causes illnesses, and it can lead to AIDS, a chronic, life-threatening disease. 6. Symptoms of the early stage of HIV may include fever, headache, and sore throat. 7. Signs and symptoms of the late-stage HIV infection include persistent, unexplained fatigue, soaking night sweats, swelling of the lymph nodes for more than 3 months, and chronic diarrhea. 8. Gonorrhea is a bacterial infection of your genital tract. The bacteria can also grow in your mouth, throat, eyes, and anus. And 9. Most women do not have symptoms of gonorrhea. If they do, they're often mild and could be mistaken for something else. Well, students, this has brought us to the end of today's session. There is so much more to learn about sexually transmitted diseases. I am Miss Alexander saying bye for now and see you in the next lesson.